This is Mike Couch. We want to welcome you to this episode of Dental Ergonomics 101. Joining me on this episode is our ergonomic expert, Janet Couch. The threats and challenges persist. We need to step back and take a different perspective. So let's jump in and get to the bottom of this issue. In the previous episodes, we discussed the what and the how of the threats and challenges to the health and well-being of the dental care team. Simon Sinek, the author of Start With Why, created the powerful golden circle paradigm. While the what and the how are important, to address the issue, Sinek in the golden circle says the solution begins with why. To find real answers and achieve lasting solutions, we must ask why. Earlier, we identified the primary challenges. To get to the why, we are going to look at cause and effect. Reduced productivity is the effect or result of neck, back, and shoulder pain and/or eye strain. Let's first examine the why of neck, back, and shoulder pain. As we discussed in episode 2, the pain associated with neck, back, shoulders, and even wrists are effects known as work-related musculoskeletal disorders, or WMSDs. The primary cause of WMSDs is prolonged static postures, or PSPs. But is that the total answer? We believe not. We need to look deeper. To put this in context and get to the real cause, we bring images of Miles back and use a 5 whys protocol to drill down to the likely cause at the center of the threats. First, why did Miles miss 2 days in his practice this month and 9 days last year? The discomfort from his neck and lower back spasms has just become intolerable. Second, why does Miles have neck and back spasms? They are symptoms of the WMSDs he has been dealing with for years. Third, why doesn't Miles do something about this? His weekly chiropractic visits and inversion table help treat the symptoms, but don't eliminate the cause. Fourth, why does he have WMSDs in the first place? Throughout the day delivering care, he continually puts himself in prolonged static postures. Before we get to the final why, let's take a closer look at posture for some clues. For the discussion about posture, I'm proud to turn the mic over to Janet.
First, let's clarify healthy or neutral posture. The resting position of each joint is the position in which there is the least tension or pressure on nerves, tendons, muscles, and bones. It is also the position in which muscles are at their resting length, either contracted or stretched. To illustrate neutral posture, we found this series of excellent drawings at dentagamma.com. Neutral posture is indicated by a plumb line of 3 points, the ear, the shoulder, and the hip joint, within the normal spinal column curves. Forward flexion of the trunk at the hip 0 to 20 degrees is within a healthy range. Forward flexion of the head at the neck of 0 to 15 degrees is within a healthy range. One point of difference is the hips should really be at 5 to 10 degrees above the knee. From an anterior or posterior view, shoulders should be relaxed without hiking, like shrugging. Weight should be evenly distributed on both hips. Arms should be within 20 degrees of abduction, as illustrated. People don't move in straight planes. Usually there will be rotational and lateral components as well. Now, with the reference of healthy or neutral posture established, let's look at several examples we found from various presentations on the internet.
Pay close attention to the next 7 photos and see if you come to the same conclusion we do about the root cause of the PSPs and subsequent WMSDs.
In this illustration, we can see the flexion at the hip is within the 20-degree limit. The neck flexion is at approximately 90 degrees, and there is a lateral lean of the back and neck. This second image from a frontal view shows considerable lean forward and to the side. Why? In these 2 lateral views, these 2 clinicians are within healthy limits for hip flexion. But we see an unhealthy neck flexion of approximately 89 degrees on the left and about 110 degrees on the right. Why? 2 things to note in this photo are the dentist is in extreme neck flexion even though he is using magnification. It appears they're not adjusted correctly. More on this topic later. Also note the position of the elbows and hands. In this photo, very similar issues to the photo on the left. Because of the leaning, that armrest is not doing any good, and the head position again is at extreme flexion. Why? In this final example, there are numerous issues to consider. This is going to be fun. Ergonomic equipment won't solve the problems unless used appropriately. This dentist is using a saddle stool and has elevated his hips above his knees, but the left foot is not flat on the floor, which can cause instability. Variation of body types will affect optimum positioning. It is important to adjust the chair based on the dental worker's height and leg and arm length. With the forward tilt, we see the shoulder in appropriate position, but the elbow flexion could cause symptoms if prolonged posture is maintained. In spite of using magnification, there is way too much neck flexion. Why?
So there you have it. Do you have an answer to the fifth why? Did you find the commonality amongst the photos as to why Miles suffers from PSPs? The answer and conclusion we have come to is best stated by our great friend, Dr. Ken Schwiebert. Seeing better equals better dentistry. Clinicians put themselves in unhealthy postures to see what they're doing. We'll address this significant issue in the upcoming Ergonomics 201 series. Before we get to the solutions and our recommendations, we will devote the next episode to the issues of vision, eye strain, and the subsequent reduced productivity. As always, we invite you to send your questions to michael.couch@caringquest.com and like us on Facebook at facebook.com/caringquest.